Zambia has put in place a national multi-sectoral action plan to combat antimicrobial resistance. Strategies are therefore required to optimize use of antimicrobials as well as reduce infections. Antimicrobial stewardship in hospitals is key among these strategies. It is against this background that the Hospital Pharmacists Association of Zambia, in collaboration with the university teaching hospitals and the Brighton Lusaka Health Link, have initiated a hub and spoke model of antimicrobial stewardship capacity building. The Commonwealth Partnership for Antimicrobial Stewardship, CWPAMS 1.5, was a 6-month project that was being implemented in Zambia by the Brighton Lusaka Health Link.
And as we know, the CWPAMS 1.5 was being implemented by the Brighton Lusaka Health Link in collaboration with the PAS, Hospital Pharmacists Association of Zambia, and the Ministry of Health at the University Teaching Hospital, which is the biggest hospital in Zambia, as well as the spoke hospitals, which were Kitwe and Kawe Central Hospitals.
The hub and spoke model has been used across sectors to augment peripheral services by centralizing key resources. Hence, this model was used in the development and enhancement of antimicrobial stewardship practice improvement across public hospitals. These are the components that made up the training.
So going forward, we need some more hospitals to be part of this hub and spoke, where a hub is like a bicycle, a hub is holding other facilities. So UTH is able to capacity build other hospitals.
What were the objectives of this project, and were they met?
From the experience that we had gained in building capacity at the University Teaching Hospital, we came up with we developed a training module which was approved by HPCZ, and through this we were able to train our colleagues.
So basically the exact objective of this was one, establishment of antimicrobial stewardship committees in the facilities that we are working with, then two, to ascertain the prescribing pattern in these hospitals, where we are able to conduct the point prevalence surveys, so that they can spearhead antimicrobial stewardship activities within their facilities.
During the 6 months that the project ran, we've been able to transfer knowledge and skills to 2 institutions. This is Kitwe Teaching Hospital on the Copper Belt and Kawe General Hospital in Central Province.
In total, 42 health workers were trained in antimicrobial stewardship between February and April of 2022. 55% were male and 45% were female.
OPAS provided or made available human resource, which is the pharmacists and the pharmacy technologists, to be able to undertake tasks that enabled good outcomes in terms of antimicrobial stewardship. That is both in Kitwe and in Kawe Central Hospitals.
Enhancing antimicrobial stewardship across the country is essential in the fight against antimicrobial resistance. The 2 spoke hospitals testify to this and are thankful for the knowledge and skills passed on to them.
We saw capacity being built in our members, both at Central, that's Kitwe and Kawe, also at the University Teaching Hospitals and Ndola Teaching Hospitals. We had capacity being built, and we had exchange of knowledge between us in Zambia and also our colleagues in the UK from the Brighton Lusaka Health Link.
I wish to mention that I think this is one of the areas in our hospital that has been neglected for a long time. When we went out on the wards to do the survey, and we have actually noticed that there are so many gaps in terms of antibiotic management on the ward. I wish to mention that this training will help us a lot. One, to establish the committee and to strengthen it, as well as it has enlightened a lot of areas that clinicians, they need to be sensitized on how to prescribe antibiotics, how to demand for a cultural sensitivity test from the lab, and so many areas.
I would like to appreciate the Brighton Lusaka Link on behalf of the Antimicrobial Stewardship Committee here at Kitwe Teaching Hospital for the efforts they have put in to ensure that we have antimicrobial stewardship activities at the hospital and the district at large.
Our desire is to continue to impart this knowledge to the other hospitals. You know, this knowledge that we've acquired is quite important in ensuring that we fight the antimicrobial resistance. I just want to take this opportunity to thank the funders of the project, because we've benefited as a hospital and other institutions have benefited, and we've seen that with this project we've learned a lot of things, and we've been able to actually ride on the project to improve our delivery of healthcare, especially in terms of infection prevention and even in the management of antibiotics.